Hello and welcome to this recorded presentation for the employees of Apex Dental Sleep Lab for the benefit year beginning January 1st, 2024, going through December 31st, 2024. My name is Bill Hammett. I am pleased to be your insurance expert. You're welcome to reach out to me throughout this open enrollment process if you need some help with choosing the best health plan for you, finding doctors, understanding the benefits, any of those kind of things. Also available is Rhiannon and Anna. They're available throughout the year to help with missing ID cards, claims issues, doctors not being in the network, looking up different doctors, providers, facilities, whatever we can do to help, we're here for you. Go through our agenda here, quick timeline of open enrollment, medical, dental, vision plans available, a couple of screenshots helping you understand the enrollment process. And then if you have any questions, if you need any answers, we're here to help you. So November 27th through December 8th is our open enrollment period. This is the time where you can enroll, you can waive, you can add a dependent, remove a dependent, upgrade your plan, downgrade your plan. This is the time you can do literally anything that you want. Any changes that you make would go into effect January 1st. We're asking that everybody do this no later than Friday, December 8th. You would log into the Ease benefit portal to make your elections. You'll be getting an email very shortly if you haven't already inviting you to log in. So you'll have a nice clean place to click a button and log right in. We have 11 plans available, just like we did last year from Blue Shield, Sharp, Kaiser, and MediExcel. All right, so we've got some HMO plans, we've got a couple of PPO plans in there, and we have a MediExcel plan, which is great for those of you that prefer to get your coverage south of the border. So here's our Kaiser plans. We got a bronze, silver, and gold plans here. Just a heads up on these plans, the bronze level plans are always going to be your lowest cost, but the highest risk for you, meaning you can have this plan, but if you need to use it, you'll pay the most out of your pocket. You'll have the most limitations. So we're looking at this bronze plan. We have a $6,300 deductible here. You have a copay for doctor visits, $60 for a regular visit, $95 for specialist, deductible waived, which is a good thing. It means you get this right off the bat. You do not need to pay the deductible. For the first 3 visits combined, meaning regular doctor visit, specialists are all down here at urgent care. These $60 numbers here, these are all a combined visit, 3 max. Okay, after that, you have to meet your deductible before you get these copays again. We see a $40 copay for diagnostic lab. This is blood work, deductible waive. That's good. But if you need an X-ray or an MRI or a CAT scan or a hospital stay or a surgery or emergency room visit, you're going to be asked to pay the full $6,300, and then you pay 40%. They pay 60% until you hit $9,100. Notice how that's different from even this silver plan, which is going to be a really good value. All these silver plans are good value plans. Still a pretty high deductible, but much more manageable. We have the deductible waived unlimited amount of times for doctor visits, $65 for regular, $100 for specialist, $30 copay for blood work, $75 for x-rays, deductible waived. Okay, that's good, but you still have to meet your deductible before they pay for MRIs. Prescription drugs, we have a brand name drug deductible of $500 here, just like we do on our bronze plan. This means that for drugs Tier 2, 3, or 4, Tier 4 is not on here, but it's self-injectable drugs, these cancer drugs, the Hep C drug that costs $75,000 for a 6-week prescription. You have to pay the first $500 of the cost up front, and then you pay a $100 copay for some of these other tier drugs. Generic drugs, you get a $20 copay right off the bat. Percentages still apply here with our hospital stays and surgeries and emergency room. When you see this 45%, what it tells you is you have to pay 100% of the cost up to your deductible, $2,300, and then you pay 45% of the cost. Kaiser pays 55% of the cost until you hit $8,750, including the deductible. Once you hit $8,750, you are covered 100% for the rest of the year. Kaiser pays for everything all the way through midnight on December 31st for all covered services. Okay, out-of-pocket max is important. That's a lot of what you're paying for in these health insurance premiums. It's the deal you make with them that at a certain number, you pay nothing, they pay everything. All right. Now with this deductible and this out-of-pocket max, a lot of the things you're spending down here are rolling up to these numbers. So anywhere you see a copay, so deductible waived, you don't have to pay your deductible, but it also doesn't apply to your deductible. But the good news is it does apply to your maximum risk. So let's say you had a regular doctor visit of $65. Your out-of-pocket max would be $8,685 left. So you just subtract 65 from 8750, and then if you had that major catastrophic event, then you would already be $65 towards your maximum out of pocket. So that's how all that works. Same with prescription drugs. All these numbers roll towards your maximum out of pocket. Let's say you needed a CAT scan or an MRI and it was $900. Well, you have to meet your deductible before you get this copay. If you paid $900 for an MRI, then you would only have $1,400 left of your deductible. So as you can see, it's kind of a rolling number that you're chipping away at with small claims, or if you had some major claim, you would hit it all at once. But it is something that only happens once a year. It's not like car insurance deductibles where each incident is its own standalone deductible and all that stuff. With medical, all these deductibles and out-of-pocket maximums accumulate. Your current, what you're paying throughout the year for different services is accumulating towards these numbers. Here's our gold plan, much lower deductible, $250, much lower out-of-pocket maximum, copays all the way across, no brand name drug deductible. And then as we get down to our hospital stays, we see a flat $600 copay after your $250 deductible for 5 days max, meaning if you're in there for 7 days, you only pay that copay of $600 a day for 5 days. After that, no more copay. If you need a surgery, it's $335. If you land in the emergency room, it's $250. Urgent care is $35. So your gold plan is going to be your best Kaiser plan. Same setup here with our sharp plans. Bronze plan's got the high deductible, got some copays for 3 visits. Our silver plan has got a better looking deductible, but still a little bit high. Copays across the board here for many services. You see the percentages down here. And even in the gold level plan, we see a lower deductible, lower out-of-pocket maximum, lower copays, but we still see percentages for our hospital stays and emergency rooms. So be aware of that. If you know you're gonna have an expensive year, if you know you're gonna have a lot of claims, I really think you should look towards that gold plan. If you haven't used your health insurance plan in 5, 6, 7 years and don't have any plans on using it, those bronze plans will do you perfect. And if you're somewhere there in the middle where you do have some claims or you don't like all that risk, those silver plans are really good buys. Blue Shield, our trio plans, we have just the 2 trio plans, a silver and a gold. Trio Blue Shield means you go to Scripps doctors. Okay, so if you want to see Scripps doctors, you want to go with Blue Shield Trio. If you want to see Sharp doctors, you go with Sharp. If you want to see Kaiser doctors, you go with Kaiser. So pretty simple. Just wanted to point out, Blue Shield Trio means Scripps. All right. And here we see our $2,500 deductible, our copays that are a little bit high, our percentages in the hospital emergency room, and our gold plan, lower deductible, lower out of pocket, better copays, flat dollar copays for hospital stay, surgery, emergency room. Blue Shield also has a multi-tiered prescription drug plan, so certain pharmacies have better coverage or lower copays than others. Here's our PPO plan, again, silver and gold, same idea here as far as benefits, but the biggest difference is with PPO plans, you've got a much larger selection of providers you can go see. You got freedom to move within the different medical groups and medical providers and hospital systems, whereas with HMO plans, you always have to stay within your medical group. So lots of flexibility for our PPO members if you value that, but of course, it comes with a higher price tag. Here's our MediExcel plan. This is a wonderful plan, no deductible, max out of pocket of $4,500, $20 doctor visits, $250 a day in the hospital, $100 surgery, $150 emergency room. Keep in mind though, almost all the things you could ever experience with your health plan need to happen in Tijuana, okay? So you have to go south of the border to get coverage. If you do, it's much better as far as lower cost. This plan will be by far the cheapest plan in the portal when you're looking at the different costs per paycheck. But just be aware, if you take this plan, you've got virtually no care in America. You have to get everything done down south of the border. There is a couple of pretty important exceptions. The biggest of which is that if you have an emergency this side of the border, you have an emergency in Mammoth Mountain or in La Jolla and you break your leg, you could go straight to the hospital and get treatment in America, even though this health plan is a Mexican health insurance plan. They do cover emergency services up here. Also, they do have some urgent care centers stateside that is very helpful. But if you need an MRI, you need x-rays, you need surgery, you need to see a doctor, you need prescriptions, all of those things have to happen south of the border. Let's talk about our dental and dental plans. We've got 3 HMO dental plans from Delta Dental. We have our bronze HMO, which is going to be your lowest cost HMO, really great for those of you that just want a couple of free cleanings. Silver and gold are going to have better benefits, a little bit higher price tag. All 3 of these give you this access to the same exact network of providers. It's the Delta Care USA HMO network. So same exact doctors and dentists are available with all 3 of these plans. The difference is going to be the level of the copay. So the bronze plan is going to have the highest copays. Gold will have the lowest copays. Let's look at our PPO dental plans. We have 3 options here: silver, gold, and platinum. Our silver plan is going to be the lowest cost PPO dental plan, platinum the most expensive. But please note, one of the biggest things about PPO dental plans on a positive side is that you've got tons and tons and tons of choice on who you go see. On the negative side, there is a maximum calendar year benefit. We call it the calendar year max down here. And this works in the other way from medical. Remember with medical, we said when you hit the maximum, you pay nothing and they pay everything else. With dental PPO plans, the max works exactly opposite. Once you have hit this number, the insurance company pays nothing more and you pay everything else for the rest of the year. So with our PPO silver plan, that maximum benefit is $1,100, PPO gold $1,600, PPO platinum $2,100. So the higher up the level of benefit, the more it's going to cost you. But all 3 of these have the same exact network. It's the Emeritus PPO dental network. Very good plan, very good network. Our vision plans are brought to you by VSP. It's a brand name in the business. Both of them have access to the same exact network of providers, so there's no difference in who you can see with these gold and platinum plans. But there is a couple of benefit differences. So the gold plan and the platinum plan have a $10 annual eye exam that you get. But the gold plan gives you only a $200 allowance for frames. Platinum is $250 on frames. Lenses is a $25 copay. Contact lenses are a $180 allowance with gold, $200 with platinum. But the big deal is there with that arrow at the bottom. There's a 12-12-24 plan with gold, 12-12-12 with platinum. What this means is this is the frequency in which you get your benefits. So that first 12 stands for how often you get the eye exam, every 12 months with both plans. The second number is how frequently you get your lens copay of $25. Both plans give that to you every 12 months. The last number, the 24 on gold and 12 on platinum, is how frequently you get your frames allowance or your contact lens allowance, okay? It's an or, not an and. With the gold plan, you get this benefit once every 2 years. With the platinum plan, it's once a year. I love the platinum plan. It's a very similarly priced plan as a gold. It's a little bit more expensive, somewhere around $25, $30 more per year, but you're getting these higher levels of allowance and you're getting them more frequently. So if you're using the vision plan, I strongly suggest you take the platinum plan. Now, enrollment. You're all going to get an email that looks just like this. It welcomes you to ease. It says now open employee benefit portal. It's going to come from Apex Dental Sleep Lab Incorporated Benefits Management. You're looking for this login button at the bottom. You click that button, you're going to be taken to the login screen, and you're going to put in your username and your password. If you forgot it, there's a little forgot button right there. If you have trouble with it, you can reach out to our staff, and we'd be happy to help you get logged in, send you the link again, whatever it may be. If you haven't received this yet, check your junk mail because many times it goes there. Or if you've been logged into the system before, just go to apexsleep.ease.com and you'll get right in. Once you get in your profile with your address and everything and your dependents, make sure all this stuff is correct. You're going to get to the medical plans. And for those of you that are not enrolled or haven't been through the system before, the check mark and the X will both be gray. You need to hit one of these buttons to do something, okay? If you hit the check mark, it turns green. It means I would like to enroll. If you hit the X and it turns red, it says I would not like to enroll, and it would ask you why. Once you do that, you'll be able to scroll down and you'll see these buttons on the side here that allow you to select. Once you hit it, a big green box comes all around. There's a bunch of links that are underneath here you can look at to understand these plans a little bit better. You will see your summary over here on a per paycheck basis, and you'll go through the dental and vision as well. Once you've done all that, you'll get to this screen here. It'll summarize how you've enrolled and what your costs are on a per paycheck basis. You'll hit the continue button, and then you'll sign your forms. You can sign forms here. You click this button, it opens up a box that asks you to type your signature. Once you hit next, it opens up a box to help you enter your physical signature. You'll do this either with your finger on a tablet or a smartphone, or with your mouse if you're using a desktop computer. Hit next there. It'll take you through the rest of the application, where you will simply click the green areas that will insert your signature into the forms. Once it's all finished, you'll hit the finish button on the top right of the screen, and you will be all done. You'll get an email that says, thank you for submitting your elections, and that's all you need to know. So next step, look for that ease invitation so you can log in. The deadline to enroll is Friday, December 8th. If you have any questions, if you need any answers, we'd be happy to help. Thank you so much for your time. Thank you for paying attention and listening to this presentation. It's an honor to be your insurance broker, and we look forward to helping you if you need any of our help. Thank you.